Hi, everyone. Thank you for joining us today for this introduction to collective health. We're excited to share a solution with you all. A couple of housekeeping details before we begin. You are all on mute, but we'd still love to hear from you. Please feel free to ask questions in the box provided for our Q&A at the end of the presentation. And if you hope to pass the information along, a recording of this webinar will be made available to you this afternoon. If you have any follow-up questions after today, please feel free to email us at info@collectivehealth.com. Your speakers today are Jose Corral and Mehul Jain. Jose is one of our regional vice presidents at Collective Health. With nearly 20 years of experience, Jose has held senior sales positions at Aetna, United Healthcare, and Cigna. He's passionate about how employers can embrace technology to take control of their healthcare investments. And we have Mehul. Mehul is a senior solutions consultant at Collective Health. She began her career at Mercer, focusing on self-funded clients in diverse industries ranging from agriculture to technology. After Mercer, she joined SpaceX and oversaw their benefits program. As a solutions consultant here at Collective Health, Mehul helps innovative employers maximize their benefit strategy and overall impact. And without further ado, Jose, take it away.
Thank you, Natalie. This is, again, Jose Corral. Welcome, everyone, wherever you may be. For those of you that are dealing with open enrollment, we hope open enrollment has progressed well for you and you're seeing the light at the end of that open enrollment tunnel. Mehul and I have the pleasure and honor of being your presenters today and humbled by the number of guests on this webinar. I know I speak for Mehul as well when I say this is one of the best parts of our job, to speak to folks that want to learn more about collective health. Whether you are joining us today because of just general curiosity or already planning for next year's benefits strategy, we hope today will be of value to you. Next slide, please. I didn't have to join Collective Health to realize both professionally and personally that health benefits can be painful. Personally, I lived through the pain of navigating the health insurance industry with my wife's life-threatening diagnosis. And professionally, I heard many customers share their frustration. Mehul and I have the privilege of speaking with many HR leaders and their consultants every day, and we hear the following common themes. Number one, members have a poor experience. Member satisfaction results, as many of you know, rank right around tobacco and cable TV companies. Number two, we hear that huge manual effort to just keep things going. The growing complexity of our fragmented system has prevented many of you from entertaining solutions that perhaps can deliver and perform better than the status quo. We hear HR leaders are paralyzed in keeping things as they are because of the unforeseen challenges. Number three, data is often delayed, inaccurate, or simply not helpful. One HR leader attuned this common challenge as follows: how can I plan for the future when I'm always looking in the rearview mirror? Number four, programs just don't work together. Many of you have been presented with ideas to better improve one or more aspects of your healthcare spend, such as diabetes or maternity. But then you realize attempting to introduce a solution, you create another challenge. Will it work with my other programs? How do I communicate this to a diverse or scattered employee population? And finally, little to no financial control. How often are you asked by your finance team and more now, your C-suite to discuss or defend performance or trend? And the ever ominous, what are we all collectively doing about this? Many of you tell us no longer are strategies such as benefit plan changes or offsetting costs to the employee going to work. I pause there, and if we were in front of each other, I would obviously ask for, does this feedback, do these themes resonate with you all? Next slide, please. Let's play this out. Let's play this feedback out and hopefully crystallize the complexity of what our industry is today. Let's begin with are four critical core network-based products at the top: medical, dental, vision, and pharmacy. For some of you, these may be one or two carriers. For others, it could be up to four. Next, you add in at the lower left there, you add in another COBRA vendor and a stop-loss vendor. Many of you have chosen to introduce consumerism and realize there's actually a handful of independent spending account companies outside of your medical carrier, but that would mean another vendor to manage and another added member communication hurdle. You quilt in throughout this maze some disease management or wellness solutions. Many are embedded within your carrier, but the annual engagement results that your consultants bring to you prompt you to ask, are these programs even effective? And then you wake up one morning, or more likely driving home from an exhausted day, you realize the difficulty of managing this craziness. You accept the reality that an outsourced communication strategy is what you need, and the need to layer on top of this crazy is an outsourced customer service company. Well, just reading this alone, I don't have to live it every day like many of you. It's just exhausting to just talk about it. Next slide. Inherently and fundamentally, Collective Health wholeheartedly believes that employer-sponsored healthcare has a technology problem. And true to our mission, we are here to help self-funded employers and their people understand, navigate, and pay for their healthcare. Next slide. Imagine, ladies and gentlemen, a world where you can integrate the four core category solutions on your left into one system with Collective Health on your right. Your core benefits at the top, your medical, pharmacy, dental, vision, replacing companies like Aetna, Cigna, United for medical as an example, seamlessly integrating them into the one system. Embedding a member advocacy solution where your members talk with a live human, no phone trees, empathetic problem solvers trained on your programs and network partners, replacing layered solutions such as a health advocate or an accolade. Embedding modern member and employer tools and portals that radically simplify healthcare as you know it. Over 45 customers today are not imagining this. They are living it. Next slide. So what does it mean to integrate your health benefits? To us here at Collective Health, it means giving members a radically simplified experience while you, the employer, have more flexibility to mix and match a benefit strategy that fits your population. Collective Health connects these three bubbles on your behalf. Beginning in the middle, Collective Health partners with best-in-class networks that are achieving, in most cases, the deepest discounts and the largest breadth of providers. We work with various partners for a seamless experience. The left bubble, representing our ability to work with many of the HRIS or Ben admin systems you work with today, to ingest one file, one eligibility file on your behalf, and we, Collective Health, become the parser of that file to all of your various partners. The right bubble represents one of the most exciting abilities we have here at Collective Health, an embracing of this third-party ecosystem that exists out in the marketplace today. Our list of over 140 unique integrations continues to grow every day. In summary, we are simplifying the employer's ability to partner with best-in-class networks while simplifying the administration of their benefit strategy. Now, to share more about how we are differentiating the member experience, here is my partner in crime, Mehul.
Thank you so much, Jose. So for a moment, I'd love to set aside my Collective Health hat and put on my former HR hat. As Natalie mentioned in the intro, I used to be at SpaceX and managed the benefits program, and that's the lens through which I'd love to walk you through this next experience. As an HR professional, you're often very protective of your employees because you're that front line, and Collective Health is that trusted partner that'll help employees in the exact same way that you would. So in that sense, we're very much an extension of your team. And that begins all the way at open enrollment. So we're your partner from the very start. We'll be right there alongside at OE fairs. Our member advocates are live, ready to answer any questions well before they're actually active on our plan. And we'll work very closely with you and your consulting partners to design an open enrollment strategy that's best suited to your needs. From there, once you start seeking care, we want to maintain that simplicity in the materials that we deliver. So here you can see an industry standard of what you'd expect from an EOB, an explanation of benefits, which often doesn't explain much and tends to lead to a lot of confusion. We recognized that as a gap and decided to reinvent that entire experience and created the medical benefit statements. So intentionally, these are very simple, clearly outlined, just the basic information that you need to know, right? Who did you actually go see? How much are you responsible for? And then give the employer credit for what the plan's paid. In an ever-increasing mobile-first world, why shouldn't health insurance be available on your phone as well? And we take that approach and really bring it to life. So we offer a very powerful mobile app, both in iOS and Android, that really allows you to interact with your health plan on the go. So it's one app where you can locate your providers, look up your EOBs, as well as get any of your plan details, and we'll give you a sense of what this actually looks like in one of the future slides. But healthcare is personal, and sometimes you need an actual person to help you through those needs. And for that, we have a very strong member advocate team. And this isn't just a layer on top. Because we're the health plan, we're actually administering those claims for you. Our member advocates can answer any questions regarding your claims and resolve those inquiries as well. So when you call in, there's no phone tree. You're speaking to somebody live right away. So again, thinking back to my HR days, this was an extension of myself. This was my little army of people that was going to help employees in the exact same manner of care that I would have. And it really resonated well with my employee base as well. And we empower our member advocates to provide this excellent experience through a homegrown tool. We refer to it as Falcor. It's our internal database that allows member advocates to look at all of member inquiries, see recent transaction, any claims that were issued, and it allows for a consistent experience every single time a member calls in. Our member advocates know exactly what that history looks like, and they can pick up where the last person left off, creating that seamless experience for your employees. And you're welcome to call our member advocates for everything. So anything as simple as a coverage question to something more complicated as clinical support. They're really that hub and backed by a great resource in our care navigation team. And what we've discovered is when you receive your medical diagnosis, you often require more emotional support to navigate that care as well. It's not just the prescriptions or the surgeries that are coming up, but hey, how do I actually talk to my family about my diagnosis? Or what community resources are available to me to help me really deal with this diagnosis and move forward? So our care navigators embody that social worker support, and they're there to help you through those emotional needs. I would love to take a moment to bring this all to life and walk you through a member journey. So pick your favorite employee, the person that comes to you the most for questions and needs the most help. In our instance, we'll call her Karen. So we'll walk through Karen's experience and journey with Collective Health. Karen has pain in her foot and she needs to find a podiatrist. And she goes to our Collective Health app, very easily there, she's able to look up a podiatrist. Think of this as a Yelp, but for healthcare. So it's one search bar that allows you to look for your provider across medical, dental, vision. In the same way that you search for your favorite Thai restaurant, you can come here and look for a podiatrist, and it'll only show you the providers that are actually covered under your plan in your geography, which ultimately helps you control costs because you're driving folks towards those in-network contracted providers. After Karen has sought care, we're the ones that will actually help her understand her cost share as well. So we're issuing that medical benefit statement. And again, I'd love to highlight how clean and simple and understandable this is. So just the relevant information that she needs to know, as well as the opportunity to reach out to us if she has any questions. As I mentioned previously, since we're the plan administrator, we're actually administering those claims, and you can call us to resolve any questions that you have about those claims. And there's multiple ways to get a hold of us. You're welcome to chat with us. So as we move more towards an open office space, it's often difficult to get the privacy that you need to have that private conversation. So feel free to chat. You'll be speaking with a live person, or you can email us, or once again, you can call us and you'll be talking to somebody live right away. Oftentimes, you may not be able to seek care in network and you have to go out of network. And in those instances, we want to make that experience as frictionless as possible. So going back to Karen, she's gone to her podiatrist, he recommends some physical therapy, and she finds an out-of-network provider. In this instance, we want her to be able to go to the best provider that she finds and then very seamlessly submit that claim. So something as simple as taking a quick picture, submitting that, and we're the ones that will process and reimburse Karen. So she can actually call in again to our member advocates and get a sense of, hey, did you receive that? What does it look like? When will I actually get my check? And we'll be able to give her that full visibility. As HR professionals, you're often thinking about what's the best way to evolve my benefit strategy. And you look at the various point solutions that are coming up in the market who specialize in very specific care needs. So in Karen's example, when she's looking for a podiatrist, maybe let's highlight HEAL, which is a home care doctor. So house calls for doctors, right? Let's remind Karen of all of the different plan options that are available to her at the time that she's searching for care. And ultimately, that helps to increase engagement in the programs that you have invested in. Our goal with all of this is truly to delight our customers, and it's working. I'd love to share a few testimonials from some of our members. This one's one of my favorites. So the best customer service I've encountered in a long time, maybe ever, especially as it relates to things like insurance and coverage. When was the last time you heard your employees actually brag about their health care? That's our goal here. And here's one more. This was quite possibly the best first impression of a business I've ever had. And these are the type of quotes and impressions that we aim to make on every single one of our 200,000 plus members. And we're not just reinventing the experience for the members, we're also empowering you as the employer. And I'd love to pass it back to Jose so he can talk through some of the tools that we provide for you.
Thank you, Mehul. I have to share that we open our Monday mornings every single week with these member testimonials, and it is, quite frankly, what sets I think, many of our obsession of continuing to improve the member and employer experience. It embarks us on our journey that week. Thank you, Mehul. So you just heard how we differentiate the member experience in more detail. Now allow me the opportunity with the remaining minutes to share with you how we simplify and empower our plan sponsor partners. Next slide. First, consistent with our obsession of keeping attuned with our employers' needs, we empower employers with powerful reporting tools that give you a snapshot of your population, real-time access to medical incurred data, integrating dental, vision, and pharmacy in your very own employer portal. Human resource leaders often grant access to this portal to their finance teams and consultants to help them with their daily needs. Next slide. We supplement the access to live dashboards with standard digestible reporting, including a member engagement report that keeps a pulse on what your employees are interested, such as calls into our member advocates and searches on our Collective Health app. This gives you the ability to engage in more proactive decision making. And just imagine receiving these reports on the 5th business day. Oftentimes you're receiving them from your carrier partners towards the end of the month. Next slide. we are delivering as well an ability to track performance of those product solution partners that we discussed earlier. Now you will have one portal to help you assess if your product partner is engaging, and more importantly, what to do about it much earlier. Next slide. And much like our members, we love customer testimonials, so we'll share two here. Don't take our word for it. Here from Zendesk, let's be honest, healthcare in general is very difficult to navigate. With their portal and member care advocates that answer questions for employees, our workers feel well supported. And from our friend Milt at Activision Blizzard, I believe that Collective Health has the technology and vision to change the world of healthcare delivery. So you may be asking, Jose, but Jose Mehul, is Collective Health working for your customers and members? Next slide. We are humbled to share with all of you today that we have achieved an industry average 10 times that of the industry. And when we analyze, on the right there, when we analyze our book of business renewal customers, we help them hold their medical trend flat. Next slide. Digging a little deeper into the cost results, we learned that we helped customers achieve even better results when members were engaged with our member advocates. In the middle there, minus 0.8% versus the book of business trend of minus 0.3%. Additionally, we also observed behavior was consistent with a more informed or educated employee base. So for example, less advanced imaging claims and the use of more behavioral health and telemedicine. Next slide. Before I turn it over to Natalie for question and answer, allow me to spend a few more minutes telling you a little bit about Collective Health. Here are a few of our valuable customers. We are humbled to share that we have more than doubled in growth year over year, but more importantly for us, while we have scaled, we have been able to maintain the same levels of member satisfaction results. This will always be a focus to continue to delight our customers and our members. Next slide. We proudly serve members across all 50 states, and recently you may have heard the news that we have opened our newest location in Salt Lake City. We're glad that we are going to be adding to jobs to that local community. Next slide, please. And then finally, this is a picture of our lobby that has welcomed many prospects, customers, and consultants. We welcome, you have an open invitation to always join us in our San Francisco headquarters. We have over 500 employees and growing. And our organization, as you can see, comes from a diverse set of industries such as Google and NASA and SAP. And now I will hand it over to Natalie for question and answer.
Thank you so much, Jose, and thank you to those of you who have already submitted your questions. We invite you to continue to submit them, and we will get going right away. Our first question is, do you participate in traditional carrier RFPs? Mehul, do you want to take that one?
Sure, I'd be happy to. That's a great question, and we definitely do. So we welcome you to invite us into your RFP marketing. What we're able to do is provide not only the administrative services, but we also weave in the member advocacy support, the engagement, the stunning open enrollment materials. So we'd love to showcase all of that and would welcome the opportunity to share that with you.
Wonderful, thank you. Our next question is Collective Health a TPA or third-party administrator? Jose, do you want to take that one?
I was just going to say, may I take that one, please?
Sure.
You know, in short, yes, we are a third-party administrator. We get that question often once we begin to talk about what we do. Oftentimes, people attempt to bucket all of us, right, into certain categories. Do you replace carriers? Are you a customer service, layer? And quite frankly, what we believe is we've created a new category embedding all those core solutions that you heard earlier. And I often say when I hear, are you a TPA? And that's almost like an example I heard. Amazon, started as a bookstore, but no one really thinks of them as a bookstore. We fundamentally wanted to enter the healthcare delivery right after the actual care was delivered, and the TPA, being a TPA, gives us access to those claims, and that's reported throughout all of the reporting that we offer. So yes, we are fundamentally a third-party administrator.
Thank you. Our next question, does Collective Health replace my consultant? Mehul, maybe you can speak to this one.
Sure. So here I'd love to wear my consultant hat. Prior to SpaceX, I used to be at Mercer, and I can very confidently say that we do not. Every single one of our customers has a consulting partner, and what we do is really empower the consultant. So we're arming them with data in a more timely fashion. They'll have access to the exact same real-time dashboard that you all would have as the benefits professionals, and we'll partner very closely with them to help inform what that benefit strategy looks like, but we do not in any way replace the consultant.
Okay, thank you. Our next question, what size companies do you work with at Collective Health? Jose, I'm going to punt that back to you.
I can take that one, yeah. Yeah, that's a great question. We're targeting organizations that have at least 1,000 eligible employees. Currently, we have customers that range all the way past 20,000 employees. So I would say anywhere from 1,000 all the way up. Natalie, I don't know if you want to add anything there, but that's how I would answer that question.
I think that's perfect. And it looks like that is all the questions we have for today. Before we let you guys go and hopefully get to lunch, wanted to tell you a little bit how you can stay involved with Collective Health. After the webinar, you'll be receiving some thought leadership from our team that covers an overview of our member experience, which walks through how we solve common member pain points. In the middle, we'll send you that cost report that Jose was talking about earlier that walks through the details of our medical trends. And finally, we're really excited to share with you a new report by Harvard Business Review that features top executives from Patagonia, Jazz Pharmaceuticals, and Cloudera, and how they think about getting the C-suite involved in employee healthcare. And of course, we'd love to schedule time with you and your team, so please feel free to get in touch with us by scheduling a demo at www.collectivehealth.com. We hope you enjoyed today's presentation, and we hope to hear from you again soon. Thanks, everyone.
Thank you, everyone. Have a great rest of your week.